I have been a critical care nurse for 25 years.
I've been a nurse for 10 years, and it's probably the worst time in my 10 years of nursing.
Being in this field for so long, never saw it.
You're hoping that your staff doesn't get sick because A, you don't want them to get sick, but B, like, we're working with skeleton crew. People are picking up as much as they can.
We went almost overnight from having next to no COVID to having a house full of it.
And I remember saying, oh my gosh, we don't have the beds.
I'm not sure everyone out there knew exactly what was happening in here.
Patients in multiple areas of the hospital intubated, including the PACU, and we had patients doubled up in rooms, so it was a little intense, a little intimidating.
You had a patient that you were with weeks, 2, 3, 4 weeks at a time, knowing that the outcome was not going to be good.
And then you go home, you'd be like off for 3 days, and you come back and they would have all passed away.
A husband and wife passed. We had a dad and daughter pass. We had a son and mother pass.
As soon as you sent that patient off to the morgue, because that was many of the outcomes, you just no longer take your gown off and you get a call, we get someone else coming from the floor.
Like, I try not to think about it, because if I do, I don't know how I would handle it. I kind of try to distance myself from it a little bit.
They're younger than you, or they're younger than your children. And it weighs on you, and yet you have to get up the next day and do it again. Because the people you work with depend on you to be there.
Sometimes it's the worst situations that bring out the best in people.
Even when the building felt like it was burning down and there was death all around us, there was people there to kind of help pick us back up and keep us together.
Critical care, things are changing all the time, and with COVID, things did change pretty frequently, and we needed to keep up with that.
The OR, PACU, same-day surgery, many of them just jumped right in and did whatever was needed without complaining, questioning. They just did what we asked and needed and knew what we needed even before we did. The PACU nurses, I know that surgery was closed at the beginning of COVID for a really long time, and they didn't have their regular job at all. So I thought it was great that they dropped what they were doing and came up.
And there were times we were doing like experimental stuff at the bedside. We're like, okay, these are last ditch efforts, and we didn't have some of the supplies. And so many people in like OR and PACU were like, wait, no, we have those over there. Let me go see what I can find. The longer catheter IV kits and all this stuff. So they were constantly running back and forth, utilizing what they knew they had over there.
We became friends. We sang silly songs together and made little parodies, the things that help you with your mental health to get through the day.
The emotional support little Debbie locker.
Oh, Debbie. Yeah, she was a blessing and a curse.
It's survival,
It got us through.
Yeah.
Everybody needs an emotional support snack.
There's a lot of these in here today. Birthday cakes,
Probably the Swiss rolls.
The Samoas, the Thin Mints.
strawberry shortcake rolls.
You know, it's 4 a.m. and you got no blood sugar left and you need something sweet. Even if it's full of crap, you're still needing something sweet.
Fudge rounds, pumpkin delights, probably from like November. Turtle brownies.
And it's very disappointing when you go in there and you're looking for like a peanut butter nutty buddy thing and there's none.
You take from the little Debbie and you give to the little Debbie.
There were people from the community that would send goodie baskets as well.
Somebody donated like 500 Lindt chocolate truffles.
Yeah.
It was incredible. There were boxes and boxes of them.
That definitely was a morale boost, especially when there wasn't a lot of time to sit down and eat. Being able to eat a couple chocolates, then go back out was definitely a morale boost.
They just brought in, I think, like 5 to 6 pizzas from there and said, please deliver to the CCU and thank them for taking care of the COVID patients.
I was very happy that this was where I was working during this pandemic.
Me too. It's almost made us like a stronger team together instead of, well, this is the ICU, this is the ER, that's the PACU, these are the floors. It's like we all came together at a time of stress and you know, just craziness, and it was definitely something that we needed.
If it ever happens again, I think we're better prepared. We're less afraid of it, and we're ready. And I think how we all work together as a team at Wentworth-Douglass made that happen.
We're not the best people in critical care sometimes to ask for help. We want to do everything on our own with our own. And the fact that they did many of them were able to just get up and do and not have to ask. And that was just like forever grateful.
I can't say thank you enough, really.
The value of the care and support they provided to us. That it was just like, you can't even put a figure on it or even a word to it, because it was like gold.
It's been tough, but we got through it, and I just hope that we can move forward and be better as an organization, as a team. I think COVID made a lot of us lose ourselves, but I think having the support of everybody else also helped us find ourselves too.
We're still here and we're ready for the next surge. Hopefully it never comes, but we feel better equipped to do it. So thank you.